Good morning, everyone. Pleasure to be with you today. My name is Matthew Garlinghouse. I'm a neuropsychologist at UNMC. And this morning we're going to be talking a little bit about cannabis and CBD, at least as much as we can in a few minutes. I want to thank several people who were responsible for, in particular, my training during fellowship, and some of the research grants I've gotten and the mentorship. So Gregory Holmes, one of the people primarily responsible for my T32, as well as funding from NARSAD, and in particular, Suzanne and John Golden. Also, while I was on fellowship, and my mentors, Ellen Green, Robert Roth, and Andrew Sakin, who helped me develop into the neuropsychologist that I have become. I have a few objectives which I hope to meet. In particular, just sort of to familiarize folks with the types of cannabis that your patients may or may not be using, discuss the costs. I think it's important to understand how your patients are paying for, or how patients are paying for their cannabis, and then looking at the difference between recreational use and therapeutic use of cannabis. So I think one of the things that happens when you attend large conferences is you sort of tune in and out. So I always like to start with some jokes. Hopefully they're not too punny. I'm known for my terrible dad jokes around here. So here's my first one. What do you call a pothead with two spliffs? And if you don't know what a spliff is, I'll show you here in a minute. Double jointed. Thank you. Thank you. I'll be here all day. And why do they call it a roach clip? Because potholer was already taken. Hopefully today will be educational and fun, and you can sort of sit back and relax and appreciate the presentation, which today is about culture, really, and the culture shift even from when I was in college in the early 90s. And this guy here could have definitely been my roommate my freshman year. You know, this is this sort of really rapid transition from thinking about, this kind of culture, Cheech and Chong, 1950s sort of magazines, Reefer Madness, to this very, very sort of clean, very, very scientific use of cannabis. And it, it comes in a prescription pill bottle now. You can get cannabidiol or CBD drops over Amazon. And instead of growing it out in the forest with lots of armed guards, now we have, labs that are intentionally hybridizing and growing cannabis. And you have people in white lab coats and gloves, harvesting these things. And even 20 years ago, to think that this would be the culture now, I think, people didn't think that this is where the cannabis industry, if you will, would end up. And so we need a common language to discuss cannabis. And this is sort of why I do the talk, is I'm very interested in coming up with a way that we can talk to each other about cannabis and cannabis use. In Nebraska, we take mowing the grass very seriously, and lawn care very seriously, at least out where I live, which is a little westerly. So literally, this is the lawnmower my neighbor to the east of me has here, 20 horsepower riding lawnmower. And then this is the lawnmower my neighbor to the west of me has. And it sort of cracks me up, because if you put our three lots together, you might have a half an acre worth of grass. Very serious. So this is the lawnmower that I have here, including the riding mower. Now, my neighbor also has a trimmer, has a blower, and literally he wears a backpack, right? So this is the model that he has, and then he has an edger. So what I did is I went out and I built the BFM 9000 here, my remote control 30 horsepower remote controlled mower, and it'll do 0 to 60 in 2.9 seconds. Okay, so I'm kidding about that. It's a little punny, but the point is, much like mowing lawns around here, people throw a lot of money at the technology that's involved in mowing lawns. Now, similarly, there is millions of dollars or more, hundreds of millions, being thrown at cannabis technology, if you will, and the purchase of cannabis nationally here in the country. And it's important because of that we understand Delta 8 THC versus Delta 9 THC versus CBD versus, one of the talks I gave was versus the Omaha Police Department, or OPD, right? What's allowed, what's not allowed? How do we know? Nebraska is one of those very interesting states where there aren't a lot of laws, and we'll get into that here in a little bit. The fact that this exists in a legal context, although this is in Colorado, this huge growing barn, if you will, that is just all hydroponic pot, essentially. And then understanding, what kind of plant is this? What are they doing there? What part of the plant do we smoke? How does all this work? I think is important, particularly in states like Nebraska, where essentially we're forced to sort of often buy cannabis from our babysitter's boyfriend. There aren't dispensaries locally that sort of monitor the type of cannabis that they're getting, and I'll sort of explain why that may or may not be relevant for some of our patients. And just sort of thinking about cannabis, it comes in many shapes and forms. It's not just the traditional joint here. Cannabis can be butter, it can be a wax, and you notice it's DD, butter, BUDDER. It can be flake. There's many different ways to ingest cannabis. So this is a blunt. They take either tobacco leaf or cigar casing, and they put the marijuana in that, smoke that. Then this is a spliff, where you have either tobacco and marijuana or other drugs. It's not uncommon to find these things laced with cocaine or other kinds of drugs that can be smoked. And this is sort of some of the difficulty with purchasing it in the few states that don't have meaningful cannabis laws, is that sometimes you're not entirely sure what you're getting. So as of 2021, and this map is a little outdated, you can see here that we are one of just a few states here in orange, Kansas, Nebraska, and Idaho, where cannabis is essentially outlawed in all forms. There is now, I believe, a law in the books, the map's a little outdated, where CBD may be allowed, but it has to be from industrial hemp. And the last time I spoke to a group of lawyers, none of them would openly sort of admit to their understanding of the law. And so I think it's also a little, I think it's a little nebulous. It's not necessarily well understood here in Nebraska. But if you look around us, right, a lot of states here in the light green are having medical use. States in the darker green are having medical and recreational use. And some are just doing CBD, which is cannabidiol, and we'll talk about that here in a moment. I mentioned cost earlier, so I think it's important to realize what we're paying. This map always cracks me up a little bit because this is Washington, D.C. here, and of course, it's the most expensive in D.C. But here in Nebraska, apparently, the average cost of sort of medium quality marijuana is about $248 an ounce. And an ounce, while it doesn't sound like a lot, really is a lot. And I'll go over kind of how much an ounce is and how much people are or aren't smoking, and how you can, as a clinician or even as a patient, appreciate the difference between recreational use and therapeutic use, because there are differences in the effects on our system, in particular thinking, that I'll try to get into, that are different between the two types of uses. So part of the problem is, even if you look at this map here, what's happening is we have many states where there is medical or recreational use. All of these states tend to sell the cannabis in a form that lends itself to smoking. And as a provider and as a patient, you need to ask yourself, is that really the product that I want? Two, they tend to sell it in forms that often encourage a lot of use. So in some states, for example, you can have on your person at any one time up to 3 ounces. I mean, that's for a therapeutic user, that's a huge amount of cannabis, and that lends itself, I think, towards sharing with your friends and getting into distribution and other kinds of problems. And so what we're seeing is that, this sort of access to cannabis and the state laws that control access to cannabis is really outpacing the science and societal controls. And I remember very vividly when, for example, this sort of first became, about a decade ago, and this became a big deal in Colorado. And the people that were into the distribution market couldn't put their money in federal banks. And so they had literally hundreds of thousands of dollars just sitting around in safes. And so one of the growth industries in Colorado at that time really was theft. Is, you could go and break into the dispensary and get $500,000. And these are just, this is just the evidence, right? How much do you know about the cannabis that you're buying versus how much you know about the grass in your lawn? To go back to that metaphor, we want to know what's in our cannabis, right? That's the difference between therapeutic and recreational use. Is that for therapy, you have to smoke a certain type in general. And for recreational use, you can sort of smoke anything because the point is different. You have easy access. Is that really what we want? So in Northern California, there was several articles about mothers that were using cannabis K-cup tea to treat morning sickness. Again, we know that that's problematic. The THC levels in the cannabis that we are getting from our babysitter's boyfriend, very high relative to this sort of what we consider the Cheech and Chong era, right? 30% THC, unheard of back in the day, right? These is ultra hybridized plants to produce this much THC, and our body treats it differently. It actually becomes physiologically addictive in that form. And that's the reason that a lot of the drug dealers, if you will, the manufacturers of illegal cannabis are doing this, is that they know that you can get people more high, but you can also find more actual physiological dependence. Whereas for a long time, the thought about cannabis is that it was more sort of, non-physiological dependence. And then we want to discuss CBD, because if you watch TV at all, we note that cannabidiol, or CBD, is in everything, right? It's in the cream you rub on your joints. You can get CBD gummies, and as it turns out, CBD cures everything, right? It's in lotions and lozenges and lollipops, and it cures cancer, and it gets rid of dementia, and you can obtain it at Amazon, as I mentioned. And is it the same as THC? Is it different? How do all these things work? So I have about 10 minutes left, and I want to try to kind of go over these questions pretty quickly. So, I want to just highlight that I'm not either pro-cannabis or anti-cannabis. I just sort of want to understand how cannabis and CBD affect patients and their cognition, thinking skills, which is, as a neuropsychologist, is what I assess. And I sort of remember back to when I want to say I was still an undergrad, maybe in grad, and the movie Angels and Demons came out. And you may or may not recall that when this movie came out, there were a lot of protests against it. And the theater, actually, where I was going to go see the movie, had the light bulbs stolen from the movie cameras. And so I came to watch the movie with some friends, and we couldn't see it because the theater was essentially non-functional. And they did an interview with some of the protesters. And the thing that struck me was one of the protesters that they were interviewing said, "I don't know a thing about this book. I don't know a thing about the movie. I just know that it's bad." And that's sort of a quote. And so I think, we want to understand kind of what it is, its pros and cons, without being too judgy. So just a little bit of trivia. There are two main types of smoked cannabis, indica and sativa. So you'll note that this is the picture from the growing, well, essentially pole barn in Colorado, and you can see the plants are really tall. They tend to have really tall spikes, and then the buds are harvested off of these. The indica is a smaller sort of, well, weed-like plant, and you can see some of the buds here that are harvested for smoking. What the medical industry is interested in is hybridizing this plant because you can breed higher CBD levels into the plant. And it's the CBD in our system as a human that really manages pain in many ways and reduces some of the harmful side effects of THC. And so in general, for therapeutic use, you want to have higher CBD and lower THC concentrations, whereas it's easier to hybridize these plants often, even though in the wild there's lower THC to CBD ratios. But you can hybridize these and they tend to produce more THC to lower CBD, and so that will get you really, really high, but it's not necessarily therapeutic in that moment. So I usually, you have to have a way to talk to your patients, or patients, you have to have a way to talk to your providers about how much cannabis you're using. And so I usually go by bowls. This is a bowl. Usually people will smoke about 1 to 2 bowls per joint. And I always joke that because we're converting grams and drugs here, sometimes people are really good with math as a consequence of buying cannabis. So 1 ounce, if your patients tell you that they're using 1 ounce of pot a week, that's about the size of a coconut, and you can see that you can get a lot of bowls out of the amount of bud that would be in a coconut. And that's effortful smoking. That's very, very recreational, even a half an ounce a week. That's a lot of cannabis use. And that amount of cannabis use is associated with changes in thinking and brain chemistry, which I'll get into briefly here. It's not therapeutic in that moment, right? You're smoking essentially to get high. And so that's sort of the cutoffs that I use. What you want to hear for often therapeutic use, and again, we'll get into this, but nobody technically should be smoking cannabis for therapeutic use. You should be using tincture or edibles. But what the equivalent that you want to have is you want to have sort of maybe 1 or 2 bowls a day spread out. So again, 1 ounce, that's a lot of cannabis, even to be consuming in 2 or 3 weeks. Now, there are over 80 active constituents in the cannabis smoke. These are called terpenoids or terpenes, and they vary across plants and strains. And delta-8 THC, which is sort of an unregulated compound, people think of it as sort of like THC light, if you will. But you can access that here in Nebraska, at least for now. I don't know if they're developing laws to address this or not, but there's all of these things in the market that are available, and you just sort of have to understand kind of what they are, right? You can get vape, THC, and all these other things, and they're problematic because when they increase the THC content by vaping, they do it in such a way that they increase also the content of all of the toxins in the vape. And so, especially if you're buying it illegally, what they do is all of the herbicides that they use when they're farming, the concentrations of those chemicals go up often in the vape that you're buying. And so you get not only higher THC content, but you also get higher load of toxins that you're inhaling into your system. So cancer and cannabis, these are a list of the terpenoids or terpenes, and we have studied, maybe 2 of them to some extent. And so again, this is sort of the society outpacing the science. Some of these may be beneficial, some of these may not be. As a science, we're not particularly sure. Some may have anti-inflammatory effects, but again, we're not particularly sure about how all of these things come together to interact. And they're all present to some extent in the product. So ultimately, the high or predicting the effect of the cannabis that you're going to ingest, it's difficult. And so you want to buy cannabis that's grown in fairly controlled circumstances and not sort of illegally in parts of the country. Now, should you go to Colorado and try a gummy or a cookie, I just want you to remember that the effects of edibles take about 30 minutes to become apparent. So don't eat the entire cookie. It's like 6 servings. Just eat a little bit and then, give it time to kick in. So just quickly here, how does cannabis affect the brain? Again, this is the brain. It takes a long time to grow, 20 plus years in the human species after birth. It's very intricate. And just so you don't get too bored here, I just want to share a quick story. When you read up on cannabis, you'll figure out that 420 is a big number. And it has to do with time of day. And it's either the time of day that students at a certain high school in California would gather after detention to smoke pot, which sort of increased the amount of detention they got. And then they started to tour with the Grateful Dead, and then the Grateful Dead band guys caught on. And so it sort of became this culture. But April 20th, 420, all of these things are very relevant to pot culture. And how does pot work briefly? So THC has a similar structure to a compound called anandamide. Anandamide is a part of the endocannabinoid system. And these receptors for THC are primarily in the central nervous system in areas like the hippocampus, the cerebellum, and the basal ganglia, which are parts of the brain. And they're heavily involved in sleep, mood, appetite, memory, repetitive drives. And so when we smoke or ingest THC, it fits here like a key in a lock, if you will. And one of the things that our research noted is looking at the effects of cannabis on patients diagnosed with schizophrenia, who have higher lifetime rates of substance use. And the reason for that is a little unclear. We know that they can tell you, patients can tell you that it leads to frequent hospitalizations and often makes their symptoms worse, but they often continue to use. And so one of the models of substance use that I was involved in exploring was that there is this, it's not so much a negative reinforcement pathway as a positive reinforcement pathway. And I don't have a lot of time to explore that in this moment, except to say that the positive reinforcement pathway suggests that the use of drugs in certain patient populations actually corrects an imbalance in the system. And so while that's not saying everybody should use drugs, it is saying that pharmacologically speaking, maybe we could make drugs pharmacologically that help people feel better, right? So this is some of the early research I was involved in. We'll skip this. Here I am testing out what is literally a hookah that we use so patients could smoke cannabis in the MRI scanner. There it is. My goodness, that was a process. I can't believe I ever wore that shirt with that tie. That's terrible. But anyway, this is a cannabis cigarette from a government-controlled facility in Mississippi that gives these things to researchers. So we did the research. And essentially what we found is that when in patients with schizophrenia, when they were doing certain tasks, such as winning money in the MRI scanner, while they were under the influence of cannabis, their brain was more ready to process reward in a more normal way. Whereas when they didn't use cannabis, their brain was not processing, particularly anticipation of reward. And that may lead to symptoms of amotivation and apathy and contribute to, some of the more negative symptoms. And so the Dr. Alan Green in particular was very interested in seeing if we could pharmacologically develop a medicine that would address some of those sort of harder to treat negative symptoms, amotivation, apathy. However, in patients, so in recreational users, one of the things that we tend to see is the opposite. So I don't smoke cannabis, but if I were to start smoking cannabis, not being in a patient group with a dysregulated brain reward circuitry center, what I would experience is this over recruitment. The brain becomes overactive, and it begins to over recruit brain areas during thinking and during tasks, and it's not efficient. And then the end result is in chronic cannabis users, they tend to perform more poorly on tests of memory and processing speed, and at times judgment, inhibition, things like that. Although the findings are subtle. And so there's been some good research on how the use of exogenous cannabinoids affect neurotransmitter release. And again, over time affecting downregulation. And I apologize, given the time, I can get into this a little more. If you have questions, you can email me. But there's ultimately less downstream inhibition, and so the brain's recruiting more brain areas, and it doesn't work well. Sort of like when they were putting in all those bus stops on Dodge, and we all had to drive through 2 lanes of traffic for 40 blocks. I'm not bitter. I'm just saying. Now, let me advance some slides so that we can talk a little bit about cancer patients. So, for cancer patients who were essentially using cannabis short-term, so not long-term, short-term, and they were using it more medicinally and less recreationally, the studies that are present do not show that there's a lot of cognitive change that's related to the cannabis use. So that's good. And, one of the interesting things is, there may be some anti-neoplastic activity, which is a unique way of saying that in animals, it's been shown that sometimes the use of THC is related to changes in tumor growth and slower acceleration of tumor growth and other treatment positive kinds of findings. It's not been duplicated in humans, and I think that's really important to note, but I'm sure there will be some research coming out in the next 5 or 10 years that really looks at the interaction between cannabis and tumor growth factor and things like that. So the good news is, for short-term use by patients that are diagnosed with cancer, the cognitive side effects are minimal, and the general medicinal effects, if you will, and I know that's controversial, that include perhaps enhanced appetite, better sleep, anxiety control, things like that, seem to sort of outweigh the risks of using cannabis, again, according to state law. Now, as I mentioned, you don't want to smoke cannabis, so this is a vaporizer here. There are plenty on the market. And what you do is you put the cannabis cigarette here, and you put this big bag over it, and it holds all of the vapor, but it doesn't fully combust the cigarette. And so technically that's all vapor and not smoke. So that's better for you. Studies out of UCF have been involved in this. And then these are edible, so you can bake with cannabis. You put it in butter. You can make cookies and that sort of thing. I am out of time, and so I will stop here, but I'd be happy to answer any questions that folks may have at this point. It's a pleasure to be here, and I look forward to answering your questions here. Thank you.